10 minutes to go or 7 minutes?
6.
6. Okay. The major command, Dr. Mr. Kamal Kishore would be giving this as a keynote.
Okay.
And Mr. General Bindal would be giving a kind of a introductory remark. And Dr. Sandhya would be giving a full floor presentation. And then Dr. Bhargav would give a kind of a India's initiative as a in the form of medical public awareness, as a public health, and then we will have a kind of a discussion after your presentation, Dr. Sandhya, and then we will have a kind of something as a kind of a takeaway. What are the takeaways? How one should design a public campaign for this particular issue. Is that okay?
Perfect. Sounds fantastic.
Good. Dr. Radha?
Yes, sir.
I see Mr. Kamal Kishore has joined. Good morning. Very good morning, Mr. Kishore. Kamal Kishore ji. Namaskar.
Good morning.
Good morning.
Good morning to you as well. Can you hear me?
I can hear you very well. In the meanwhile,
Okay,
you can
good.
get to introduce Dr. Sandhya. She is from Auckland. This is a practicing doctor. And
Okay.
Good morning. Nice to meet you.
Good evening,
Good
Shruti.
afternoon. Good evening.
Yeah, you are ahead of 7 hours from us.
7.5 hours.
7.5 hours. Okay. And Mr. Kamal Kishore is a member of the National Disaster Management Authority, Government of India, as the apex body of the disaster management in the country.
Okay.
And we are just waiting for General Binder to join. 11:30 sharp, we will start. So I take this opportunity to welcome all the panelists. Dr. Radha, you are the coordinator, and so I welcome you also. And Dr. Sandhya, and of course, Mr. Kamal Kishore for this particular Janandolan session, which we have as a kind of appropriate behavior. So I'm just checking with Mr. Bindal so that Dr. Radha, have you sent the link to Major General Bindal? Can you check Dr. Anuradha, Janandolan NIDM ID?
Sir, I'll just.
I think he has joined. Yes, I can see. Give me the signal if the moment 11:30, already 11:30. So we can start now. Good morning, friends. I am Santosh Kumar, work with the National Institute of Disaster Management, Ministry of Home Affairs, Government of India. This is very, very important day as that we are going ahead with the kind of a public awareness webinar. Honorable Prime Minister, Mr. Narendra Modi has actually on the October of 8th gave a public campaign seeing the kind of the festivity season which is coming to India and large number of expected crowd likely to face this kind of a situation where that we see that Dashara just ended. We are either the Bakrid is over. We are waiting for Diwali, Bhaiya Dooj. Then we are also waiting for Chhat Puja, Christmas, and the New Year 2021. So all these festivals, as a being a social animal, we tend to greet each other with a kind of we give hug to each other, we handshaking we do with each other, and also we greet each other in a different manner depending on that what kind of practices which we have. But at the same time, the reality is this that we are also grappling with the coronavirus COVID-19 pandemic, which is not ended, and rather it has magnified many times than before. So there is a time that we should be extra careful, and we should be taking such kind of measures which our panelists would be talking about, other than also that social distancing, washing hands, wearing of mask, personal hygienes, which we have been practicing for the last 7-8 months. But how seriously actually we are engaged into these practices, that depends on that is reflecting in the kind of cases which is happening. It means somewhere we have not been that careful. So that is why that cases are increasing. So we need to be extra careful, and we have to save ourselves and also save others. So in this context, I welcome the distinguished panelist, Shri Kamal Kisorji, member NDMA. We have Dr. Bhargav from ICMR. We have Major General Manoj Kumar Bindal, Executive Director NIDM, and we also have Dr. Sandhya from Auckland, New Zealand. She is 7.5 hours ahead of our time. So Indian Standard Time, we have started our deliberations at 11:30, which we would be continuing for 2 hours from now. So this is the kind of a challenge which we are saying, that why we go for a public awareness as a Janandolan. The idea is to have everyone informed about this, and information does not remain confined to the information as such. How it is leading to action and also leading to changed behavior, and the changed behavior also gets kind of a how it becomes the habit of individual for protecting from the coronavirus. This is a kind of a thing which I was also thinking to share some of the important global campaign of the social cause, which has been actually very kind of but that I would do not now. I would be doing at the end of the kind of this deliberation, so that we also remember those things what we had in the past. So, friends, this is a very important thing that we are deliberating. Once again, I take this opportunity to welcome all of you. Major General Manoj Kumar Bindal, who is the Executive Director of the National Institute of Disaster Management, who is anchoring this entire this kind of initiative, especially making people aware and also taking this various agenda and functions of the National Institute of Disaster Management. Under his leadership, many of the things are being organized. So I would request Major General Bindal to kindly give the introductory remarks. I welcome all the distinguished delegates who have joined so far and who would be joining in times to come. General Bindal, I welcome you and I request you to kindly give the introductory. General Bindal.
Can you hear me now?
Yeah, please.
Thank you so much for inviting me. This is a very important webinar on which we are conducting because Prime Minister has recently launched it in October 2020 to Janandolan for ensuring COVID appropriate behavior among the citizens of the country. I welcome all the esteemed panelists who are here, Shri Kamal Kishore, member NDMA, Dr. Sandhya from New Zealand, and Dr. Balram Bhargav, who's joining us shortly, and all the participants who have already joined or are in the process of joining. It is very important that we are aware that this unprecedented and unanticipated challenges which have come up during the COVID-19 and which has made us realize, everyone realize that collective action and support from all is the only way to deal with such pandemics or such type of disasters, large-scale disasters. So while all necessary measures to fight the spread of the coronavirus, novel coronavirus, and COVID-19, they are being effectively led by the central government and the state governments. There is a need to reinforce the importance of preventive measures and practices in a sustained manner to deal with the disease over the long run, because vaccine is not in the horizon as of now, and vaccine will take some time to come, and we don't know when actually and how effective that will be. So while all necessary measures to fight the spread of novel coronavirus are being effectively led, there is a need to reinforce that the growing public indifference to wearing masks and avoid mass gatherings and other related issues, which is leading to increase in the number of cases. Prime Minister, Honorable Minister Narendra Modi ji, he launched this Janandolan, which I referred earlier, for COVID-19 appropriate behavior in October 2020. So the campaign was launched by the way of a tweet in view of the upcoming festival and winter seasons, as well as the opening up of the economy. The aim of the campaign is to encourage people's participation, and a COVID-19 pledge to be taken by everyone. It endeavors to be a low-cost but high-intensity campaign with the key messages to wear mask, follow for physical distancing, and maintain hand hygiene being of paramount importance. In this connection, a concerted action plan was implemented and is being implemented by the central ministries, state departments, the union territories, with region-specific targeted communication in high caseload districts as per the requirement. It also includes simple and easily understandable messages to each and every citizen, dissemination through the country using all media platforms, banners and posters at public places involving frontline workers, and targeting the beneficiaries of the government schemes. So it will also involve installing hoardings, wall paintings, electronic display boards in government premises, involvement of local and national influencers to drive home the message, and running mobile vans for regular awareness generations. Our audio messages, pamphlets, brochures will be distributed in a bid to create this awareness. And support of local cable operators and media also is being sought for effective outreach and impact. The decision has been taken to remind the public that the pandemic is still raging, and as masks, social distancing, and washing hands are the three ways to remain safe in absence of any vaccine, the central government has launched the public campaign to raise awareness about these measures in public places. So it is pertinent to note that India has so far been able to keep the COVID-19 casualty count low and recoveries very high. The campaign is intended to keep it that way. In addition, the various appropriate behaviors for COVID-19 also include greet without physical contact, maintain physical distance, wear masks at all times, avoid touching your eyes, nose, or mouth uh, unless you have sanitized your hands, maintain respiratory hygiene, wash hands regularly and thoroughly, regularly clean and disinfect frequently touched surfaces, do not spit in the public, avoid unnecessary travel, do not discriminate against anyone. We have seen that during COVID-19, the health workers were targeted since they come in contact, they were targeted by people who were not coming in contact. So such discrimination should not happen. Do not circulate social media posts which carry unverified or negative information. Seek information on COVID-19 from credible sources. Call government helplines for any query, and seek psychological support in case of stress or anxiety, if any. So if these measures are effectively implemented at public places across the nation, the number of cases will be minimized. In addition, the health workers, the sanitation staff need to be extra careful, and proper procedures have to be put in place that they are given the required kit, they are being enabled in every way possible so that they remain healthy and they keep the environment healthy. Medical waste disposal is a major issue which is coming up. Medical waste, right from the moment it is generated in a ward, or even not in a ward, even at houses, that is the mask that we use, of gloves that we wear for our own protection. All these things are a source of potential community carriers, community spread carriers. So their management and their disposal by the municipalities or the local administration needs to be given a extra attention, so that the medical waste is properly disposed of, and it is not contributing to the spread of COVID-19 virus. The use of volunteers, the youth, the civil defense, educational institutions, volunteerism by the citizens needs to be promoted. They need to be motivated, and for that the local heroes have to come forward and lead from the front. There has to be a focused approach, but it should not lead wrong interpretation of the orders. The orders came that all those in a vehicle should be wearing a mask. So the drive was taken last Sunday in this city, wherein I saw people catching families who were in a private car, and if one of them was not wearing a mask. Whereas it is the public transport which needs to be targeted. A family is staying at home without wearing a mask, and when they're in the protective environment of their own private vehicle, driving from place A to place B, the importance of wearing masks inside a closed vehicle by the members who are staying 24/7 in the same house without wearing a mask is not understood. So that interpretation of the correct understanding of the orders is very necessary so that it is implemented in the right sense. Media, I have already highlighted, and they have a major role to play. Today, the media outlets, especially the TV media, paid media, is not reflecting enough on COVID-19 appropriate behavior. And I think that requires a fillip for the whole thing. And public places is the most vulnerable, most sensitive, and hence they must be targeted in a big way. And I will appeal to all the volunteers who can help out in this, because it is not possible for the government to step in each and every location. Some responsibility has to be taken by us as citizens of the country to reduce this COVID-19 spread. With this, I finished with my inaugural note, introductory remarks, and I'm keen to hear other panelists. Thank you so much, and over to you, Professor Santosh.
Thank you very much, General Bindal. मास्क पहनना, जन सहभागिता, हाथ धोना और शारीरिक दूरी, ये बहुत ही महत्वपूर्ण है। और इसके साथ साथ जो लॉ की जो अंडरस्टैंडिंग है इन्फोर्समेंट एजेंसीज की, उसका इंटरप्रिटेशन भी सही होना चाहिए। किसको पकड़ना है, किसको नहीं पकड़ना है, किसको इन्फोर्स करना है, किसको नहीं करना है। एक इनेबलिंग इन्वायरमेंट ऐसा होना चाहिए कि पूरा इकोसिस्टम, इसकी जो हम बात कर रहे हैं कोविड प्रिपेयर्डनेस की, एप्रोप्रिएट बिहेवियर की, इसमें ये सुनिश्चित करना बहुत जरूरी होगा। साथ ही साथ जो वॉलंटियर्स की जो अपने रोल हैं, उस पे हमें किस तरीके से देखना है, उनको किस तरह से आगे लाना है। प्लस जो बायो हमारे यूज है, मास्क को कहाँ फेंके, सामान का कैसे इस्तेमाल करें, अस्पतालों में जो चीजें बाहर करनी है उसको किस तरह से हम प्रोटेक्टिव इन्वायरमेंट में, ताकि लोगों को उसका नुकसान ना हो, आदि आदि। ये बहुत सारी इंपॉर्टेंट चीजें हैं which you have highlighted, and we need to carry forward that how actually appropriate behavior at different levels by different agencies, by different people are to be taken. इसके साथ ही मैं श्री कमल किशोर जी को आमंत्रित करना चाहूंगा। श्री कमल किशोर जी सदस्य हैं भारतीय आपदा प्राधिकरण के, आपदा प्रबंधन प्राधिकरण के, जो शीर्ष स्थान है भारतवर्ष की, और कई देश और विदेशों में इन्होंने कई जगहों पे अपनी बात रखी है और एक डिस्कोर्स को बदलने में मदद की है। आज कोविड-19 के बारे में जब हम चर्चा कर रहे हैं, we have seen that how countries grappling with the larger number of cases. Every city is now having that kind of a red zone kind of scenario. Globally also many countries are now going for the second wave or third wave, and also thinking of another lockdown, selective lockdown. साथ ही साथ हमारे देश में भी चुनाव की प्रक्रिया भी चल रही है और अन्य देशों में भी चुनाव की प्रक्रिया चल रही है। तो किस तरह से हमारा अप्रोप्रिएट बिहेवियर इन सभी स्थानों में फेस्टिवल के साथ साथ हो, और चूंकि आपने इसको देखा है, तो आई वुड रिक्वेस्ट यू टू काइंडली गिव दिस इनॉग्रल नोट as a keynote speaker, as a keynote address at that how we should take this agenda forward of Honorable Prime Minister COVID-19 Janandolan. Mr. Kamal Kishore.
Thank you very much, Professor Santosh. Major General Jindal already talked about the campaign that the Honorable Prime Minister launched a couple of weeks ago. So I'll just build on that. I will not repeat what General Bindal has already said. I think one thing which has become very clear in the pandemic, the way this pandemic is different from other disasters that agencies such as mine, the National Disaster Management Authority, is used to dealing with, is that everybody is susceptible and everybody needs to do their bit. No one can say that they are not susceptible, and no one can say that they don't have a role to do in it. So, I mean, hence the rationale for a Janandolan or a mass movement. So, but how do we get to a level where the participation of the country's population in COVID-19 sensitive behavior is very, very high? I don't know whether we can put any estimate to what is the level of compliance right now, but we can certainly say that it is not at a level that we desire. You know, for us to be able to say that we are now doing everything we can in terms of behavior, I think the compliance would have to be something like 80 to 90%, and we are far below that. So how actually realize the objective of making it a mass movement? So I want to propose before you 5 key approaches. There is nothing new in what I'm going to say, but these are just reminders. first thing that I want to say is that we have to draw from the experience of disaster risk management. We've worked on how do you do flood sensitive behavior, how do you do heat wave sensitive behavior, how do you do earthquake sensitive behavior. So there is something we can draw upon that, and drawing upon that we have to invoke the notion of creating a critical mass of people who not only follow COVID-19 behavior but also talk about it, and by doing that create the whole notion of social conformity. When you have a critical mass of people who begin to do that, then people who don't follow that, they should have some about being felt, being isolated, being out of the sort of norm. So how do we build how do we build COVID-19 behavior as a social norm which is widely accepted, so that if you don't follow it, you are the odd one out. So I think that is something that we need to pursue. The second thing I would say is how can we use the influencers? We have seen influencers, when you make a phone call, you hear Amitabh Bachchan's voice urging us to behave responsibly in this era of COVID-19. But we have to go beyond that. There have to be influencers at the city level, at the neighborhood level. There has to be different kinds of influencers at the level of in urban areas, in rural areas, people who actually have a sway over people. So, we have used the Prime Minister himself is one of the biggest influencers. And beyond that, we've also used, Amitabh Bachchan, other celebrities, but there are other local level influencers. So we need to identify them, work with them. There could be faith-based organizations, faith leaders who could actually promote that. Particularly important in the time of festivals. So that's the second thing. How do we develop fully the role of influencers? The third thing I want to say is that while we are doing a social media campaign and broadcast media campaign, print campaign, we also have to see how we can utilize our own cultural resources. Can we develop folk songs which basically include COVID-19 behavior? Can we use local other performing arts to actually, can we use Nukkad Natak? So how do we use our own cultural resources? How, the Ram Leela season has just gone by. It would have been interesting to see how we can use, the format of Ram Leela itself and insert, in a dramatic way, in an interesting way, the message of COVID-19 behavior. So we must not underestimate the cultural resources we have that we can actually rely upon for making this happen. Fourth is, we have to, while we are talking about people adopting COVID-19 behaviors, we also have to see what the government set up at the central level as well as state level and local level. Civil society organizations, what is it that they can do in terms of enabling conditions? So, if we have to talk about, everybody should wear a mask, everybody should focus on clean hands, maintain distance, we really have to say that in some parts of the country, it is also an issue of logistics. I think to a large extent we have addressed that, but this is not something which just goes away. We have to continue to focus on it, and we have to see how we can create an environment where following COVID-19 sensitive behavior is easy. It is not a struggle for people. And fifth and final point is invoking penal provisions. General Bindal talked about the penalty imposed on people traveling in cars. So I think we have to have a whole suite of this as well. It is in a deliberate way that I put this as the fifth point. There is a limit to how far a penal provision can go in, starting a mass movement. Mass movement really should come from within the society and not from the force of the state. But it is still required. There should be disincentive for people to deviate from COVID-19 behavior. So if we did these 5 things, brought in the concept of social conformity, used influencers, utilized our cultural resources, created enabling conditions, made judicious use of penal provisions, I think we would be able to quickly turn this into the kind of mass movement it needs to be, not just for a few weeks, but several months, perhaps lasting beyond a year, to be able to combat the problem of COVID-19. Thank you very much, Professor Santosh.
Thank you very much, Mr. Kamal Kishorji. Very nicely put up that how the risk management behavior can very well seamlessly can get integrated into this COVID-19 behavior, appropriate behavior. And acknowledging the role of the cultural resources, that is very, very important, that we have, India is very rich in those resources. We have theater, we have cinema, we have local folk dance, folk songs, and so forth. And you have highlighted it, that how that could be used in terms of developing this behavior, appropriate behavior. And the role of influencers, Honorable Prime Minister himself is a big influencer, and also that other local celebrities along with the Bollywood celebrities. So that local celebrities and then the fitness organizing, these are to be weaved into a kind of a framework of entire process of changed behavior. I'm grateful to you that you took time and actually highlighted all those 5 points as a very, very important, and what kind of a rural and what kind of urban behavior are required to be taken into the changing environment, as COVID is going to stay for another year or so. So it's not that we should be forgetting and the behavior become irresponsible. And if it becomes irresponsible, what General Tindal said, that which you have reiterated, that penal provision, that how that can be enforced by the enforcement agencies. So thank you very much for giving these insights, and I would request you to kindly stay as long as you can. I know that you are very busy in another meeting, but I would request, we had Dr. Anuradha, have we Dr. Sandhya on the board? Dr. Anuradha, are you there?
Yes, sir.
Yeah, Dr. Sandhya, I can see you now. So she's on the board. Her presentation is there on the share mode.
You need to.
Thank you very much. So now I would request Dr. Sandhya. I welcome you. You have been interacting with us in the child-centric DRR, in that bringing the children into awareness mode. Now we are thinking children and parents. Now here we are going for a kind of a countrywide campaign, that how that can be taken up. So I extend my heartfelt thanks to Dr. Anuradha, because she has been able to maneuver and want to practice session with you yesterday, so that your session go very comfortably. So Dr. Sandhya, I would request you to kindly present your views, and many viewers are there who can really be benefited, to inform you about the audience that you have made very, very useful videos, small videos for educating people, and which you have translated in many Indian languages. So that could be probably useful for us, and other than Spanish and other Arabic, which you are doing it, but Indian languages which you have been able to focus. So people are eager to, so I would request you to kindly start your deliberations, and I welcome you once again on behalf of NIDM and Government of India. Thank you.
Thank you so much, Professor Kumar, for the invitation to talk today and present my ideas on this Janandolan initiative that has been launched by Honourable Prime Minister Modi ji. And I'd like to say namaste to everybody and kia ora from New Zealand. So actually, I've entitled my talk today. Can you see my slide?
Yes.
Are you able
We
to-
can.
Yeah, you, okay. Okay.
We can see you. Go ahead.
Okay. So I've entitled my talk today, Fighting COVID-19 India, Self-Empowerment and Individual Responsibility for the Collective Good. And I think Major Bindalji and Kamal Kishorji both have, talked about this, and as has Professor Kumar, that, it is really every single person has a responsibility in this pandemic for the collective good. And so that is a very important thing for everybody to understand. And we need to basically remind ourselves of this, because this COVID-19 pandemic is a marathon. It's not a short-term race. And unfortunately, everybody around the world is getting a little bit fatigued, a little bit tired of having to, continuously take the precautions. But these precautions have to become a way of life and part of our normal behavior until such time as, a vaccine is developed and, we are all able to come out of this pandemic. So, basically, my view on this, Janandolan campaign for COVID India is basically that we all need to learn to live with the virus. As in, we need to learn what the rules are, what the parameters are that we need to make part of our daily living, so that we stay alive, basically, and well throughout this whole pandemic. We don't want to die from the virus. And, we have come a long way since the pandemic began, back in December last year. There has been a lot of progress in terms of treatments, in terms of our knowledge about, how we can mitigate risk and avoid getting the infection. So, this information, we need to learn to just make part of our daily living, so that we not only protect ourselves, but we protect everybody else at the same time. And the other very important message, which, Modi ji said when he announced this campaign, is together we will succeed. And that is absolutely correct, because only together can we succeed in getting this pandemic under control anywhere in the world, but particularly, relevant to India's situation at the moment. So actually the timing of this talk worked out quite well, because just a few days ago, I had the privilege of meeting the New Zealand Director General of Health, Dr. Ashley Bloomfield, who is the front man on the right-hand side of our Honourable Prime Minister Jacinda Ardern in our fight for COVID. And he shared some important lessons from the New Zealand COVID response. And three of the points that he shared, I think, are very relevant and something that can be applied to this campaign for India as well. So just as the previous speakers have said, collective action is powerful, and that's what has worked in New Zealand and in many of the places which have controlled the pandemic. The other thing which he said, which is very important, and I don't think the other speakers have touched on it, and I'm very passionate about this, and I think it's extremely important, that he made the point that for an effective public health action, you need to help people understand why. So, in order to motivate behaviour change for things to become habit, people have to understand why they have to do it. And the third point, which I thought was very, very good, was that in a pandemic, and in the current pandemic, there's not much that we can control. I mean, really, and people can start feeling very, demotivated and think, oh, well, there's nothing in my control. But Dr. Bloomfield made a very salient point, and that is there is always something that we can control, and that is our behaviours. And our behaviours is exactly what will help control this pandemic and protect not only us, but everyone around us. So that's the basic gist of what my talk is today, is that I would like to quickly go back over and remind everybody why it is that we are doing the behaviours of the wearing masks, the washing hands, the watching the distance, and just a few more extra points that we've learned about this virus that are very important for people in India to be aware of, especially heading into the festival season with, as Professor Kumar said, all the festivities coming up and the behaviours that go along with them, of people collecting in groups, of, people singing, people embracing, and also the fact for India and, the Northern Hemisphere, as you head into winter, a lot of activities will be taking place indoors. Also, in India at the moment, particularly in the north, I know that there is an issue of pollution. And of course, there is the decreasing temperature and the impact that has on the longevity and how long the virus lasts. So, yeah. So just I'd like to, remind everybody that actually this COVID-19 pandemic is accelerating. It's growing at a rapid exponential rate. So, the case numbers are increasing, but they're increasing exponentially. And this is all to do with this, this what they call the R0, or the reproductive rate of COVID-19. And for people who don't know what that means, it basically means that one person who's infected, it was thought that basically if somebody has COVID, they can infect 2 to 3 other people. And then those people can then go to infect 2 or 3 other people, and so on and so forth, till you have, as we have here, this, exponentially increasing number of people infected with COVID, which is what's happened. I think last Monday, the world hit over 40 million cases. And I think within a week, we're up to, we've increased by another 5 million. Now, in reality, actually the spread is, more around 5 or 6. But in some situations where the conditions are ideal for the virus to spread, which I will touch on, so-called super spreading events. I think there is one in Korea where they think that one person was basically responsible for 5,000 other people getting infected, via this, chain. So one of the big focuses of being able to control the pandemic, in the long term, and particularly in relevance to the place where India is at the moment, and it's something that countries like Japan and Korea have focused on very well, is controlling these risk factors for these super spreading events, because the nature of COVID-19 spread is that it tends to occur in clusters. So you see it happening in, places where people gather for weddings, for funerals, for celebrations, sports games, gyms, etc., so on and so forth. And the other point I'd like to highlight here, which I think people are becoming very complacent in India, because, they think, well, a lot of people are getting infected and it's all going to be okay, chalega, theek hoga, and, herd immunity ho jayega. It's not true. Scientifically, according to whatever understanding there is at the moment, there is no herd immunity possible unless and until there is a vaccine. And that is simply because that the immunity that you get from having a COVID infection is not long lasting. And we are only seeing the evidence of that now, because this is a fairly new pandemic, obviously. So, when people recently repeated the antibody levels in, people that had been infected in the UK, they found that the antibody levels had dropped, within the last few months. So, and there have been cases of reinfection. So, hoping for herd immunity and just throwing all caution to the wind and not following the rules to protect yourself and others is, going to lead to, people, loved ones becoming ill and, having bad outcomes. So this is a good reminder that basically if you have no collective response, that the cases will rise. But if you have a collective response, then you will manage to flatten the curve. But India, I would say at the moment, is at that point where you had sort of a first spike, and because you had the lockdown and things sort of maybe settled down a bit, but now what's happening is that the numbers are rising again, basically. So it's time, and it's very timely that you've announced this, Janandolan, to try and get things back under control. Now, I mean, why should I change my behavior? Why should I change my behavior? I mean, people, think that only 1 in 5 people actually end up needing hospital level care. So 20% of cases. So if you think about COVID, I mean, you think about it as this iceberg where there's all these cases which we don't know about, where people had asymptomatic infections or there may be mild infections, and then you have your moderate cases, your severe cases, and then of course in the big scheme of things, of the total number of cases, sure, it's a minority that actually die. But the issue is that we all know that although there are certain groups which are at higher risk of having a bad outcome with COVID, we've all heard and read cases where somebody who was previously fit and healthy and young had a bad outcome and died from COVID. So really, the difference in terms of having asymptomatic, a mild, a moderate, severe case, or dying from COVID is luck. So, I mean, a good enough reason to change your behavior is that you don't want to leave your fate up to luck. I mean, why would you when there is so much at stake? So that is very important. The other point, as from the previous slide, the point of keeping the cases under control is because when it doesn't, basically you exhaust your resources in terms of the hospital system collapses. Now, what happens in those situations is, if say you are in this group of moderate case where maybe you needed some oxygen and some treatment in hospital in order to survive, but suddenly, because nobody followed precautions and the hospital system became overwhelmed, and understanding that healthcare workers are getting infected at high rates, and they are not a never-ending resource. I mean, it takes years and years to train one doctor, for example, or specialist. So you need to preserve these resources, because suddenly that moderate case that needs oxygen can't get a bed, and they end up having a very poor outcome. So we need to avoid overwhelming the hospital system at all cost. Otherwise, for example, I just read yesterday the unfortunate circumstances affecting a small country like Belgium, where in a population of 11 million, currently 300,000 people have active COVID infections, and they are 10 days off having a totally overwhelmed health system, and looking at a situation where they might have to end up sending patients to Germany until such time that Germany accepts the patients. But then after that, what do you do? So in India's circumstance, I mean, I know that previously Modi ji has, talked about this Atmanirbhar Bharat. And I mean, this is the need of the hour. Everyone needs to be self-sufficient and self-reliant and understand how to protect themselves, their family, and in doing so, they will be protecting everybody. Now, it's very important in order to motivate behavior that you understand what is the enemy here, what are we fighting, what is the science behind this. Now, especially in India, where there is a lot of community cases of COVID, it's very important to understand how it is that you actually contract the infection and what it actually does, because it's, becoming paranoid or thinking that, there's a lot of virus particles around, and just by, being out and about, I will get it. That's not actually the case. So basically, COVID-19 is an RNA virus, so it looks something like this. It has this RNA, which is the genetic material that helps it replicate. It has a protein shell and it has a fatty envelope around the outside. Now, this fatty envelope is the virus's point of weakness, which we need to exploit. Because basically, if you wash your hands for 20 seconds with soap and water and dry them well, or use alcohol, 60% alcohol or greater based hand sanitizer, then you will disrupt this fatty envelope and you will deactivate the virus, and it will not, cause you any harm. Now, say you don't do that. The way in which you get infected is if these virus particles enter through your eyes, nose, or mouth, usually, by touching your face with unclean hands. Now, scientifically, what happens here is that in this outer layer, you have these spike proteins, and they are like a key. And basically, the lock is these ACE2 receptors, which sit, in great concentration on the cells lining your upper respiratory tract, so inside your nose and your mouth, on your tongue. And also there are, ACE receptor, these ACE receptor cells in different parts of your body. And this is why, it can attack virtually every organ in the body. But this is the entry point. So basically what happens is this virus enters, the protein shell finds this, the spike protein finds this little receptor, which is the lock. The key fits in, it opens the cell, and that's what the virus needs to replicate. It needs access to our cells, okay? And once one virus particle accesses that cell, that virus particle, just like the previous diagram where I showed how one person spreads it, exactly in the same way, that virus replicates in an exponential manner, and then you have so many virus particles for your body to deal with. And I will talk about this issue and why, all these risk mitigation strategies of washing hands, watching your distance, and wearing masks are important, not only to avoid getting infected in the first place. It's also very important because it will, even if you are unlucky enough to get infected, using these measures will help reduce the viral load. So even if you can reduce, the virus particles by, 1, 2, 3, or 100, that will mean that there will be that many less virus particles that your body, your immune system has to fight off. So that is very, very important for everybody to understand. And actually, I have summarized this in a cartoon, which is available on my YouTube. So even a child or any member of your family could understand. And I have this in both English and Hindi in a short cartoon, just to explain the basic science of COVID. Now, as I mentioned, COVID, once it enters, it can affect basically most systems in your body. But importantly, if we are able to, we do get infected, and if we are able to fight it up here in the upper respiratory tract, then hopefully, with strong immunity, we can prevent all of this occurring. So, I don't think there's any other picture that is more scary or more that could provide more motivation for people to take care. We've seen people get all sorts of bad long-term effects from COVID as well. I mean, it's not just getting infected, it's people get infected for a long, they don't recover, or they have what they call at the moment long COVID, where they have lasting, fatigue or, medical issues that we're still learning about. So having said that, there's basically, this COVID triangle for us to understand. So we have the virus, which we can't really change. Then we have ourselves, the host, where the virus is trying to enter. And then we have our environment. So we can't really change the virus, but we can reduce our risks by modifying our environment. So, being careful where we allow ourselves to be exposed and how we behave in those environments. And as a host factor, I would like to say that, this pandemic, one of the biggest things that have come out of it is that people are actually thinking about their health. And so as a host, I think it's a very important reminder and should be part of this Janandolan movement that we need to build our fortress and make sure that we are in peak health and immunity so that we can fight the virus to the best of our ability. So, just to reiterate, there are three ways in which the virus is, transmitted. Obviously surface transmission is there and more significant if you have somebody in your household that is infected or you're living in a city where there is a lot of community spread, such as India, such as many of the places in India in the red zones. But mainly it was thought to be through droplets, which is, the respiratory particles that we release when, we cough, sneeze, talk. But recently, and it had been contentious, that aerosols is becoming, which are the smaller particles that are released even when we just breathe or talk, they are also very important. And that is why the fourth issue in terms of risk mitigation, apart from washing hands, watching distance and wearing masks, is watching ventilation because of these aerosols. So it's very important. So to explain the aerosols, this is a very good article that just came out with these illustrations where basically, your respiratory droplet that we were, obsessed with initially are particles that are, larger than 300 micrometers, and they generally fall to the ground, before that 2 meters. And that's the reason for the, the 2 meters social distancing. But aerosols are the particles that are less than 100 micrometers, and they can remain suspended in the air for hours. And you can think of it like smoke. If somebody was smoking, you can think of those particles like that smoke if you wanted to try and visualize them. And the important thing to understand is that the amount of aerosols that we emit increase in amount and concentration depending on the volume of the person speaking and the duration the person is in the room. So so you can see in this diagram how the particles are increasing after 15 minutes and then an hour, and the maximum particles is if people have been this person has been singing for an hour in this room and no windows have opened. So here they've got 50 times more particles than they had sitting silent, just one person in a short period of time. And this is something very, very important for people to understand in order to, reduce their risk of getting COVID and getting a high viral load of COVID. So, as I said, countries like Japan and have done very well in trying to, educate the public to try and reduce the risk of super spreading events. And I think India really needs to take this on board, particularly in the festival season and on your billboards, that they've come up with this mnemonic called a civic duty, which basically you need to avoid crowding indoors, low ventilation, close proximity, crowds of people close together for long durations, particularly, of course, if they're unmasked and if they're talking, singing, yelling, or breathing hard, like doing, exercise, for example. So, I mean, lower risk activities would be things like being outdoors. Now, I know in India and particularly in North India, that's difficult at the moment when pollution levels are high, that you should wear masks and that they should fit snugly, and you should wear them even when you can maintain a physical distance, particularly when you are indoors in these high risk scenarios. And the other thing which is very, very important that we need to think about is about ventilation and cleaning of the air by filtration, because that will help, reduce the number of concentration of, infected aerosols in the air. Now, this was an excellent visualization, which is a Swiss cheese, the cheese with holes, which basically shows that, in order to why are there so many different behavior things that we are asked to follow? And that's because no single intervention alone is good enough, because each one could have a flaw. So that's why we need to, have multiple layers of, protection or precautions that we take so that we can maximally protect ourselves, because as we've seen, you know, sometimes even at, you know, doing the best things, you know, people can get infected because, you know, all those flaws may line up as they're showing here. So some of these responsibilities are personal, and, you know, they're the ones that we as individuals need to focus on and do. And some of them are shared responsibilities, which I think we can discuss later on. So the personal ones, as we've highlighted, are, you know, physical distancing, staying home if you are sick, wearing masks, hand hygiene, as in washing hands for 20 seconds with soap and water, or using hand sanitizers, cough etiquette, so coughing or sneezing into your elbow is very important. Avoid touching your face, and I've coined this term, amen. You know, wear masks, amen. Avoid, whenever you go out, think, avoid my mouth, my eyes, and my nose. You know, wear masks, amen, namaste. You know, namaste for greeting. You know, no handshaking, no hugging, just namaste. And amen, I want to avoid my eyes, my nose, and my mouth, and keep saying it and teach your children. And if you're in a crowd, limit your time. That's very important. In terms of shared responsibilities, we need fast and sensitive testing and tracing when cases are identified. You know, especially when you look at things like schools opening, you know, organizations and offices need to look at ventilation. They need to look at air filtration. That we need to have government messaging and financial support. And you need to have quarantine and isolation facilities, and of course, you know, vaccine developments. So that is a very important way to think about the reason we have to do all of these different things. And remember, the goal is to try and get that reproductive rate to less than 1, because if we break the chain of transmission, and, you know, one person is not spreading it to, you know, 2 or 3 people, and they're spreading it to less than 1 person, the pandemic will stop without a vaccine. That is why these measures are called a behavioral vaccine. And if everybody does these measures, as we said, over 80% of people do it, then we can stop this pandemic. So in terms of, you know, any public health action, prevention is better than cure. In fact, prevention is the cure in terms of COVID. We want to be able to safely navigate this pandemic, and we want to be able to prevent ourselves from getting COVID until such time that there is a cure. So, as I said, you know, our individual responsibility will basically mean that, you know, collectively we will be able to, you know, vaccinate ourselves, you know, our society from this, you know, pandemic. Just if we follow these rules of, you know, social distancing, wearing masks, washing hands, and staying home if we're sick. You know, one of the previous speakers spoke about, you know, culturally appropriate, you know, songs or things which can basically help people understand. And this is absolutely a correct idea. And for my previous presentation to NIDM, I made this little hand washing video, which didn't take me long to do, but because in New Zealand, that we were told, we were, you know, educated at the beginning of the pandemic that whenever we wash our hands for 20 seconds, we need to sing happy birthday to you twice. And it's very important because, you know, this is fundamental. You need to wash your hands properly. And so I tried to make a culturally relevant video for, you know, for my Indian audience. And so I just wanted to, and this sort of video should be shared widely on, you know, on TV channels to educate people how to wash their hands properly, and to teach them that they should be humming something so that they don't rush the process. So yeah, I mean, I don't know if, anybody, we can all do with a reminder of how to wash our hands properly. So something like that, I think, would be very useful. And as I said, remember to wash your hands and avoid touching your mouth, nose, and eyes, because, you have to think that that virus, I do not want to allow it to enter and gain access to my cells and start replicating. Then, of course, is the maintain practical, practice physical distancing while remaining socially connected. So we have many modalities to remain socially connected. Although humans love, the physical touch, I think one of the reasons India did quite well compared to other countries initially is because we have this in our tradition. We say namaste, and that is a very heartfelt greeting. There is no need for shaking hands and, increasing transmission that way. Now, the masks is a very, very important thing. And, you can look at masks as basically like, now we're at a stage in the pandemic, particularly in India, where, it's very unlikely or feasible that you're going to be doing a lockdown. So the mask is our, personal lockdown. It's our personal lockdown where we're locking down our nose and our mouth. And this is a very, very important tool for people to understand how important it is. Because as you can see in this diagram, if two people are not wearing a mask and one of the persons is infected, there is a 90% risk of transmission in that interaction. Whereas if both people are wearing a mask, that risk of transmission falls to 1.5%. And then if you add in the distancing, it's virtually zero. Of course, now we've got this whole aerosol issue where, even if you've got a mask on and you're in a prolonged for a prolonged period of time in an enclosed, non-ventilated room, you still have risk of, getting infected. But the important thing to realize is that through wearing this mask, you would have not only reduced your chance of getting the infection, you would have reduced your viral load. So as I explained, that is extremely important. And in fact, now that's been proven that countries that had mandated mass masking actually reduced their rate of hospitalization. And I'm sure this is what has happened in India as well, because this led to more asymptomatic or mild infections because people were getting a lower viral load. So wearing a mask is 100% common sense and everybody must do it, but everybody must do it properly. So, masks, they are the single most important tool in this pandemic to save both lives and livelihoods. Because as I said, it will reduce your chance of getting infected. Even if you do get infected, it will mean that your infection will be less severe than had you not been wearing a mask. And it will preserve people's livelihoods, their ability to earn money, because they can still go about and do their business because of the fact that they're going around with that personal protective bubble. Now, lockdown. Now, it's very important that your hands must be clean before you, take off or put on your mask because you don't want to infect yourself. While you're out and about, do not fiddle with that mask and make sure it covers your nose and your mouth, a fabric mask is fine, a 3-layer cotton fabric mask. Think about the environment. We're talking about waste. We do not want to create another environmental disaster. So, you can use a cloth mask, you can come home, you can take it off and put it for the hot wash, dry it well and have it ready for the next day. Have several. It's fine. They work well. Do not wear a mask with a vent.
Dr. Sandhya, we have Dr. Bhargav also joined. So can I request in 5 minutes to share your,
So, and again, we need to take precautions to keep our family home safe, in a safe bubble. So keep those ones that, loved ones and elderly in our home safe. So keep our, bubbles small. Now, one of the points was that we need to be able to clean and disinfect properly. Again, I have videos on this on my YouTube and on my social media, how to make up correct disinfecting solutions in spray bottles and how you need to clean the surfaces properly so that we are making sure that we are doing, everything we can to reduce our chances of becoming infected and making sure that our environment is clean. Now, The next point I wanted to get on to is, if you actually have COVID, I mean, I know this is about, awareness about the behaviors for avoiding COVID, but it's also important, I think, to address the fact that a lot of people are getting COVID at the moment, particularly in India, and that if the way you modify your behavior, if you think you have COVID, will also be a very important education for everybody, so that also will help reduce the rate of rise. So it's very important, if you think you have any viral symptoms, and as we're coming into winter, people will get even a common cold, but rather than thinking, oh, it's just a cold and I'll go out and it'll be fine. No, any viral symptoms, you have to assume that you have COVID, and you have to stay home and isolate yourself from your family straight away and start wearing a mask. Because one of the biggest places where COVID is transmitted is in the households. And you are most infectious early. So, you need to isolate yourself straight away from your family members and, stay home and get tested and seek medical advice and wear, masks and practice strict hygiene at home. So as Professor Kumar mentioned, I recorded a video in June for my family members in India particularly and around the world, looking at the situation where basically a lot of people were facing, where, getting infected with COVID, yet not being able to access testing or hospital level care, and a lot of panic. And so this was my disaster management plan for how to, stay calm and prepare yourself should the need arise if you or your family members were to come down with COVID. And so I now have, through the help of, through the, massive global response I've received, I think this video has been seen probably in the hundreds of millions of times via a WhatsApp all over the world. I have, been dedicated to this project of getting this advice, dubbed in several languages. And now I have it in Hindi, Telugu, Tamil, Gujarati, Marathi, Bengali, Punjabi, French, Portuguese, Spanish and Russian. Now, apart from Spanish and Russian, I know that all those other languages are spoken in India. I think the other two that I'm working on are Malayalam and Kannada. And in these videos, in this video, I have basically explained the basics of COVID and prevention and how you manage, the infection optimally at home and try and prevent a mild infection from becoming severe. And I would, recommend that everybody take a look at this video, because it will go a long way in helping you feel empowered to manage. Because, the truth is that, much, better resourced countries are facing this exact circumstances. So assuming if, things go ahead and, and that's why this Janandolan and, raising awareness and reiterating the importance of behaviours is very important, because we do not want to be in this situation where, the health system collapses and the only thing you have to turn to is this video, which has happened to a lot of people. But the good news is a lot of people are getting better following these steps, because it's based, what I've done is I've based it on very, very good science and all the evolving evidence as supporting all the steps. So, I mean, these were the sort of things that I went through. Now, the first step in my video was talking about priming and boosting your immunity. And I wanted to just talk about that in terms of, as we head into the festival season, and in terms of long-term risk mitigation against this pandemic, is that it's essential that we all work on, building our immunity and a healthy lifestyle. And very important is to avoid vitamin D deficiency. Particularly in India, there's, almost universal rates of vitamin D deficiency. And, that has been proven to have a very bad outcome if you are infected with COVID. The other thing is, I mean, in New Zealand and in Australia, and people will look to the Southern Hemisphere and how they've managed to get through winter and not done too badly with COVID. You have to understand that these countries have high rates of influenza vaccine, which doesn't protect you against COVID, but it protects you from getting a co-infection with the flu and with COVID, which would lead to a bad outcome. So, I mean, that's something for, people in India to think about. There's also, pneumonia vaccines that we give to elderly people. So, and maintaining a good control of any chronic health conditions you have, and using food as medicine. It's not that you need to pop every single vitamin, but try and focus on a healthy diet with whole foods. And in terms of, the long marathon of COVID, it's very important for our immunity that we focus on good mental health and mental resilience. And, the basics of doing that is basically eating well, sleeping well and having a regular routine, exercising regularly, staying connected with family and friends in a safe way, minimizing stress, through yoga, mindfulness, and avoiding, alcohol, smoking, drugs, binge eating, all these things which will, reduce our ability to fight this infection. So this is a very important risk mitigating strategy, and for the host or for us, and will help us, survive this pandemic. So these were, the second step in my, video that I describe is the importance of reduction in viral load, as I've explained, that, and I'll talk about nasal and throat rinsing with saline and betadine and demonstrate that. And the third thing I talk about is breathing exercises and the prone positioning, which, I demonstrate balloon blowing, which helps simulate what a ventilator does and helps keep your lungs open. Now, particularly, I would bring that these breathing exercises are important, and I know that the pollution levels are quite high, and I've read also that a lot of people that suffered COVID in the first wave in India are now preventing.
Dr. Sandhya, can I request you to kindly sum up so that we can have
Sure.
some of your points during the question answer session?
Yeah, just the point with I was just saying, okay. I'll just say with the breathing is that, people that had a mild infection initially are now coming up with breathing difficulties post-COVID because of pollution. So these breathing exercises are important for everybody. So, in terms of the long term, I'd say, as I said, no herd immunity. We've got to stay calm and carry on with, the precautions and try and avoid reinfection, even if you've already had COVID, and that we need to mitigate our risks by basically, following all the rules. For the, behavioural or social vaccine for COVID, which is wash your hands, watch your distance, wear a mask, and I would add watch your ventilation. So they're the basic points that I wanted to highlight.
Thank you, but I would request you to kindly be ready with your video so that we can, at the time of question answer, I can take up your video as well. So thank you very much for giving this a very, very informative and very, very illustrative manner, your presentation, especially in the context of Honorable Prime Minister's Janandolan, where he is talking about that every individual should become responsible and self-reliant when it comes to the management of COVID. And the actions which you have suggested are very, very important for the individual and also becoming an individual kind of a responsible citizen at the time of festive season. I would get back to you, Dr. Sandhya. I'm not concluding here, but I would like to welcome Professor Balram Bhargav, who is Secretary Department of Health Research, Ministry of Health and Family Welfare, and also Director General of Indian Council of Medical Research. Professor Bhargav is also a cardiologist, very, very senior cardiologist at All India Institute of Medical Science, which is, that All India Institute of Medical Science is widely known as a kind of a very good research and treating center as a hospital. And India feel always proud in this hospital, that kind of cases they have been able to handle. And he's also Executive Director for Stanford India Biodesign Center, School of International Biodesign. So this is a very, very important scenario when we are into, when we talk about entire scenario that how we are facing with. And when it comes to that, if people are not aware and they get affected, they have to rely on the hospital facilities. And you said, Dr. Sandhya, that don't load hospitals with the kind of without taking precaution you have to have. So I would welcome on behalf of the Ministry of Home Affairs and also on behalf of the National Institute of Disaster Management, National Disaster Authority, to Dr. and Professor Bhargav for giving insight that how India's hospital facilities are prepared at the time of COVID, especially when we are having a lot of, then winter is coming, pollution is an issue, and also then we are talking about festivity. So in this concern, people behaviors are different. So the precaution is at one go and then it happens. So I request you to kindly deliberate upon this. You are welcome here, and I request you to kindly give your insights.
Thank you so much. Thank you so much. I think we've had an excellent talk by Dr. Sandhya. What I will talk briefly is about what we have done for this pandemic in the last 8 or 9 months, and how pandemic has not respected any country borders, and why we have had these pandemics. Now, if you look at this millennium, we've had the pandemics of Zika, the epidemics of Zika, 2 epidemics of Nipah. We've had SARS, we've had MERS, and now we have had this COVID-19. We're seeing that these epidemics are becoming more frequent. They're becoming more complex, and that is because of the fact that there is the change in environment, there is the ecological change, there's rapid urbanization, and there is extreme connectivity between cities and individuals having too much movement on the globe across. And that is why we probably are seeing, and the expenditure on public health has been very low all across the world, including India and many countries. Public health spending has been very low. So this remains a problem, and we will see more such epidemics in the future unless we are able to improve our environment. Having said that, the approach that India had done up till now was a sort of a very proactive, a preemptive, and a graded response, which was very calibrated, whole of science, whole of government approach, because of a very strong leadership. We continued to play with the 5T model of test, track, trace, treat, and use of technology. We did not mess around with herd immunity business at all along these 8 or 9 months that we've had this pandemic, and some nations have suffered because of that. But we took the learnings from those nations and were able to not play around with herd immunity. And as we speak, we see that the national seroprevalence last month has demonstrated that the seroprevalence is 4% across the country, while across the urban areas, 4% in the rural areas, 8% in the urban areas, and about 15% in urban slums, with a national average of about 7%. And it has increased from 0.7% in March, April to 7% only. So we definitely do not believe in herd immunity for this at the moment, clearly. And we will focus on our COVID appropriate behavior. We will focus on the masks, the use of masks, and the use of social distancing. The COVID appropriate behavior is inexpensive. It doesn't cost anything. Masks are also very inexpensive, and they are nearly as good as any vaccine as we speak. So till such time, and even beyond the vaccine development and the vaccine production and vaccine availability in the country, we will have to use the mask, and probably masks will be the last things to go, or maybe never go. So that's how I would say. And I'll start with some slides if I can share a presentation. Yeah. Can you see the slides, please?
Yes, we can see that.
Okay. Okay. Yeah. So as we speak, we have say about 42 million cases across the world, with 1.1 million deaths, and in India is about 79 lakh cases with 1,21,000 deaths. And our strategy has been 5 T's, as I mentioned: test, track, trace, and the use of technology. Now, our principle when we had this epidemic was to have a laboratory in every district of India. We had 14 mentoring institutes across the country, and we had the basic prerequisites for the lab, which was a a calibrated functional RT-PCR and a BSL-2 with training which was provided to the molecular virologist, and they had a centrifuge and an autoclave. We also set up labs in difficult terrains in the Northeast, in Andaman Nicobar Islands, in the Lakshadweep, and also Leh Ladakh and Kargil. So these were areas where we rapidly set up laboratories of RT-PCR. Out of the 281 government medical colleges, we passed a Gazette notification and were able to get 273 government medical colleges set up labs. 185 of our private medical colleges have labs. And now, as we speak, we have 650 districts which have, out of the 739 districts, have testing labs, and 89 districts labs are within 6 to 8 hours. Now, the phase one was the large cities and the urban areas where we set up the RT-PCR laboratories, as I spoke. And in the phase two, we set up the molecular assay, which we repurposed the molecular diagnostic TrueNat and the CBNat, which we were using for tuberculosis, and we repurposed them very rapidly in the month of April. And we have the Lancet now talking about these, when they talked about the DNA nudge, which the BBC touted in a very big way last month. But we have been using these labs, and more than 2,500 such labs are available across the country. And we have done about 5% of the testing with the TrueNat platform. And this is more for the district level, where we were not able to establish the RT-PCR labs immediately, and we had those TB laboratories which we repurposed. And then in the field level, we did the rapid antigen tests rapidly in the month of May, June, which the WHO approved only last week, but we've been using the rapid antigen tests accordingly, and now the United States has also started using the rapid antigen tests with a sensitivity of anywhere between 70 to 85%. As we can see that we have validated at the beginning of the pandemic in the month of March, we used to get RT-PCR kits from abroad. Much of them were imported, and the cost was about 2,000 rupees per test. Subsequently, we have validated, and startups have developed more than 1,000 as I speak, RT-PCR kits, RNA extraction kits, as well as the VTMs, and the costs have dropped to 138 rupees for the RT-PCR kit, and 91 and 94 rupees respectively for the VTM and the RNA extraction kits. So it's about 300 rupees for an RT-PCR test in our country at the moment. And we have validated a large number of these kits, and they are now being exported to many parts of Europe as well as Africa, and the country is self-sufficient in producing these kits. And the same has happened for personal protective equipment and masks. We are exporting them on a large scale now. We had the accreditation centers, and we had 30 QC laboratories which were maintaining the QC QA for all these laboratories. The 2,040 laboratories that we have across the country, which we have set up in these 8 or 9 months. The beginning in January, we just had the one lab, which was the National Institute of Virology, and subsequently we have scaled it up to 2,040 laboratories in the country. During the lockdown, again here I would emphasize that the lockdown in India was a very practical sort of a lockdown, where we didn't have something like many countries in Europe where the lockdown was absolutely ineffective, as well as in the US. The lockdown was not effective at all. And then the other end of the spectrum was the Chinese lockdown, which is really a very strong sort of a lockdown. So ours was somewhere in the middle path. And during the lockdown, we had from March 24 to May 31st, we had the Ministry of Civil Aviation, Indian Air Force, with the Niti Aayog and the Ministry of Railways, the Indian Postal Services, and the Department of Personnel Training launched a mission where they were carrying kits to all the laboratories 24/7. There were night flights, there were special flights, Air India flights, and also helicopters of the Indian Air Force taking equipment, laboratory equipment, and this all happened on like a war sort of a mission. And the Indian Council of Medical Research worked 24/7 for the last 6-7 months to really set up these laboratories, and special flights were commissioned to ensure timely delivery. Now, if you look at the number of tests that have been carried out, today we have the capacity of 2 million tests per day. We are second only to the United States in terms of the total number of tests. And we have gradually, from January, when we were doing 10 tests a day, we went up to 1,000 in March and 95,000 in May. And in October, we had about 1.2 million tests per day. And as you can see how the total number of labs and the total number of tests has gradually escalated over the months. Our testing strategy was also calibrated depending on the availability of the labs. In February, we were just testing travelers. Then in March, it was travelers, healthcare workers, SARI patients, and contacts. And then subsequently, we had clusters, ILI. We also did pooled testing wherever the positivity rate was less than 2%. We allowed pool testing, and therefore this helped us tremendously in the rural areas to do pool testing. And subsequently, we did hospitalized patients, immunocompromised, pre-surgery, and since last month, I think we have testing available really on demand, and the turnaround time for our RT-PCR test is 90% within 24 hours. We have a dashboard for demand forecasting for every state. This was launched in April of 2020, where we had a stock out of status, lab requirements, suggestive dispatch quantities, and this was all across the country. We had 20 ICMR national depots, which were set up in the 20 national institutes for distribution of testing commodities across like a mission project. And we had the data entry portal, which is and we completed 100 million tests last month, and this has helped us in disease trends, policy making, resource planning, as well as clinical decision making, and the capacity of assessment of labs and matching procedures, streamlining of purchasing, including testing commodities, tendering platforms, and having all these commodities now available on the global e-market was done again with analyzing the laboratories, the types of stock mix, the types of machines that they have, the manpower, the number of shifts they had, the operating hours that they were doing. We again, in the month of April, we developed the ELISA. We isolated the virus. We were the 5th country to isolate the virus in the month of March. And we developed the ELISA test in the month of April, and we used it for carrying out the largest sero survey of 30,000 people across the country in 70 districts and 700 villages. This was done in April, and we had a prevalence percentage of 0.7% at that time. Subsequently, we also have released 3 issues of the Indian Journal of Medical Research, which has 3 dedicated volumes of all publications which were from India and the neighboring countries on the research, as well as the clinical profile, as well as the testing methods. We issued advisories, letters to all stakeholders, and press briefings, and we made a national task force which was responsible for calibration of testing strategy, advised the government on lockdowns and containment strategies. We developed advisories, provide oversight on ongoing research, recommend required clinical trials, develop clinical management protocols, and explore newer and repurposed treatment options. In terms of the vaccine, we entered into an MOU with the Bharat Biotech, and the strain was transferred to Bharat Biotech. They developed the COVAX vaccine, and this vaccine was tested in preclinical studies in small and large animals, including non-human primates, and the phase 1 and phase 2 trials are completed, and the phase 3 trials for this vaccine have started. And we are also planning to start the clinical trials in neighboring countries of Bangladesh and Myanmar and other countries for this phase 3 for this vaccine. This is the preclinical trial, which is in the press in Nature Communications, and this is we found excellent safety profile in all the 3 species, high neutralizing titers at 3 and 6 micrograms, and also good Th1 based antibody response at day 28 in mice, rats, and rabbits. A similar study was conducted in hamsters, and they were sacrificed on day 65, and we found that they had a robust humoral response, and this is in Science and Cell and Press is under review there, and excellent Th1 immune response in group 3 and group 4, where we had 3 and 6 microgram with adjuvant B, and a rapid viral clearance in the lower and upper respiratory tract in these hamsters. We also did Another study at the National Institute of Virology in Pune on non-human primates. This was done again 24/7, experiments going on till 1 p.m. at night, with the vaccine doses being given at day 0, day 14, day 28, and necropsy at day 35. And the blood, nasal, throat, rectal, bronchial, alveolar lavage, urine, stool, and organs were all collected, histopathology and stainings, and we found very good neutralizing antibodies with helper T cell response in group 3 and group 4, with complete viral clearance from all body fluids and organs on day 35 in group 3 and 4. This is under review in Nature Communications. And then we completed the phase 1 clinical trial, which started in the month of July, and 375 participants, and we found again excellent neutralizing antibodies with safety and good immune response and T1 responses. And the phase 2 trial also is complete. The second dose has been given and the blood samples have been collected and being analyzed, and within a week's time we will have the results of the phase 2. The phase 1 paper is under review in the Lancet, and the phase 3 trial starts this week and in 26 centers, 26,000 patients for this vaccine. We have partnered with the Serum Institute, the Oxford vaccine, and they have completed their 1600 phase 2b3 last week. The first dose of the vaccination, the second dose will be the end of this month. And we also have developed our national vaccine platform, which has all the data on what the vaccine are available, going to be available, and are being tested in India. In terms of the role of BCG, we have completed a study on 1,400 patients, participants. 1180 have been completed, but as we speak, 1,400 participants have been enrolled. Some of them, about 100 of them, had completed 1 month, and their blood samples were collected to measure their immune response, and we found excellent immune response with BCG in the elderly above the age of 60 and 80, and 60 to 80, and we will be looking at their follow-up at 6 months in terms of their benefit in COVID. We have developed equine sera, equine hyperimmunoglobulin, and this is in a private-public partnership with Biological Events, and we have got approval for phase 1 clinical trial for these sera, which were inoculated in the horse and collected after 21 days, and then the Pieranti and ELISA assay was done, and subsequently the pepsin digestion for purification of the fat fragment of the antibodies. As we look at the randomized trial across the world, we have not much to speak except the recovery trial from the United Kingdom, which has clearly shown that steroids benefit in COVID-19. The solidarity trial from the WHO has shown that remdesivir is not working that well, and then we have the largest trial across the world on convalescent plasma across 39 hospitals and with 350 scientists with 464 adults randomized to convalescent plasma, and this was published in the British Medical Journal, which clearly showed that convalescent plasma is not working in moderate to severe cases or preventing moderate to severe cases, and this was published on 22nd October, and the editorial clearly says that the bar of the science that India has published has been raised across the world in this COVID pandemic, clearly congratulating the fact that how trials can be done rapidly during a lockdown from 24th April to 14th July. The randomization was done rapidly, again 24/7. People were working till 4 a.m. at night and having VCs with different hospitals and doing this trial. We conducted the 1/10 of the WHO solidarity trial was from India out of the 30-country trial, and this has clearly demonstrated that remdesivir and lopinavir interferon have little and no effect on mortality, and this is still in preprint and not yet published. And these were the sites all across India which were managed by our National Institutes of AIDS Research across, because of the network of our 26 institutes. We had deputed each one of our institutes with the responsibility of completing each one of these projects on a war footing. We did the National COVID Sero Survey. We had done 2 of them, the largest ones, and the first one was in May, June, and the second one was in August, September. The number of participants was 24,000 and 28,000, and we clearly demonstrated in the first sero survey, the seroprevalence was 0.7%, and in the second sero survey, it was 6.6% across the country, with 4% in rural areas and 7% in urban areas, and about 15% in urban slums. Subsequently, different cities, different states have done their various sero surveys, and none of them is hitting between up to 20 or 25%. And Delhi is the highest, probably 27% to 28%. The three sero surveys is now talking about 27%. So we are far, far, far away from herd immunity. And this paper of our seroprevalence is in Press in Lancet Global Health. And the reinfections, we looked at the reinfection data because we have now the data of 100 million tests available, and we are churning the data to get out what we can in terms of reinfection, in terms of other clinical presentations, correlation with the air pollution, correlation with the festivals, etc. And we have found that we had 40 cases of reinfection in the ICMR database, and this has been sent for publication in JAMA. In terms of newer initiatives, we have the biorepositories across the country, and we have a clinical COVID registry, which is being strung around with 15 mentor institutes across the country, and each mentor institute has 3 to 5 hospitals. So at the moment, we have about 50 hospitals feeding all the data in the registry in the format that we have described. So this will have enough data available for us in terms of the clinical registry. So we have had partnership with the Department of Biotechnology, Department of Science Technology, CSIR, Ayush, and the MHRDs for validation of diagnostics kits, for antiviral screening, for Ayush regimens, for validation of devices, textile products, mobile applications, getting labs, biorepositories, indigenous vaccines, and diagnostics. And we have it has been a government approach straight from the Cabinet Secretary and the empowered groups with the National Task Force and the Ministry of Health and the various stakeholders which have worked rapidly towards this pandemic. Now here, important point to stress is that we would like to emphasize that during this festival season, we are going to have festivals, we are going to have the cold, the virus likes the cold, we have air pollution, we have people who would be returning from countries, from the neighboring states where elections have been held, and we also have the marriage season. So that is a worrisome part, particularly for Delhi. Although the country has shown a downward trend since October, the downward trend has gone down from 95,000 cases to about 45,000 cases per day. But cities, major populations like Delhi, West Bengal, and Kerala are still on the rise, and that is the worrisome aspect. And therefore, till such time we have a vaccine, and even beyond, we have to continue with our COVID-appropriate behavior and the use of masks at every level, and absolutely non-essential travel and non-essential meetings should absolutely be avoided, and we should try to meet as much as possible on VC. Thank you so much for your attention, and I'm happy to answer any questions.
Thank you very much, Professor Bhargav. We have received a couple of questions during your deliberations also, and also Dr. Sandhya with you. One question which is very pertinent, which is coming up as a kind of a festive season, and you talked about this vaccine second stage and third stage. One question has come up on by likelihood of coming of this vaccine into practice, when you are expecting that country should get the confidence that yes, vaccine would be there. So this is one question. I will just tell you 2-3 questions so that you can group and then you can respond accordingly. Second question is coming up, this especially when you highlighted about Delhi, and they are talking about the Delhi, one is this temperature and also Parali, this pollution. So in the context of the two, and the third which you have highlighted, that people coming from the high election areas or this Bihar and other places. So how you advise people what Dr. Sandhya has said and the preventive measures, or if not, then how that hospitals are hospital readiness to take care of those. And the last question, which at this moment is, it's very strange that we do not have the treatment, but still we have the 93% plus kind of a recovery rate. How it is possible? These three things are on the floor of the people wish to know from you.
Sure. Thank you so much. I think in terms of the first question regarding the vaccine, we have completed the phase 2 of the trial. Many countries have approved after phase 2, whether it be Russia, whether it be China, and other countries have approved the use of vaccine under emergency use authorization for specific conditions, whether it be hospital workers or frontline workers. So that has been done in certain countries. And I do not know what the government stand will be and how the company will apply for, whether they will apply for emergency use authorization or not, would depend in the very near future. In terms of the phase 3 trials for the Covaxin ICMR trial, which has started this month, we will not have results for the phase 3 completion by the March or so, February or March. We should have the results. Before that, we should have the phase 3 trials of the Oxford vaccine by December. But the important thing to remember is that the phase 1 and the phase 2 have clearly established the safety. They have clearly established the immunogenicity, but they have not established the efficacy. And efficacy of a vaccine is only established by a phase 3. And the WHO has also said that the efficacy of above 50% is acceptable for a vaccine. Now, coming back to the point of Delhi, in terms of Delhi, the air pollution remains a big problem. And as we know, the largest killers across the world from the global burden of disease data is, one is malnutrition, number 2 is high blood pressure, number 3 is tobacco use, and number 4 is air pollution. So we know that it is one of the top 4 killers across the world. So air pollution remains a huge concern. And there have been some studies from Italy in certain areas of lockdown in Italy and certain areas of high pollution in Italy, where they have clearly demonstrated that air pollution was closely linked to the COVID-19 mortality. There was a study from the Howard Chan Institute in Boston, which has also shown that they have found the virus particles in the air pollution particles. Now, these particles, whether they are just the RNA of the virus or they are the actual live virus, is not being demonstrated. It's probably RNA particles, which are also there. They have found in the as we find in the sewage, which are not harmful, but they have shown that they can also go there. The last point regarding hospital readiness is concerned for Delhi. The hospital readiness is there, but as we are seeing during this month, when the cases are rising in Delhi, we are seeing a negative balance of about 150 to 200 beds every day for Delhi. Although Delhi is prepared for more than 15 to 20,000 beds in terms of admissions, and there are certain COVID centers as well, which have been created and are still 40%, 50% utilized at the moment. So we do have plenty of facilities available. But the last question that you asked about in terms of treatment, when we have no treatment available, we clearly have 2 or 3 treatments which are well established. One is the use, once you get COVID, the treatments that are available are the use of steroids or cortisone, the use of oxygen, they have both been reduced mortality, and the use of blood thinners or antithrombotics. These 3 have shown to be beneficial and these all 3 are inexpensive and available in India in plenty from that perspective. The last point that I want to emphasize is that we have to use masks and COVID appropriate behavior to prevent from getting the disease. We have to prevent the paranoia, the stigma, and the fatigue, and concentrate on COVID appropriate behavior in every sphere of life. And I wish everyone all the best. I think the Delhi government with the Disaster Management Authority is working extensively in terms of the hospitals, in terms of the facilities, and these, since we have had the first spike in June, and we had a second spike in August, September. So Delhi is getting ready for the third spike, which is, as we speak, slightly higher than the second spike. And therefore, we have repeatedly been planning accordingly, and the Delhi government, with the help of the central government, has been working on that in every which way. The population of Delhi is 2 crores, which is very equivalent to any country in Europe. So from that perspective, we have to be very, very careful and still maintain COVID appropriate behavior and the use of the masks. Thank you so much.
Before I go to Dr. Sandhya, one more question I would like to have, and then we will have Dr. Sandhya's response on what you have suggested about appropriate behavior is the solution at this point of time. When we talk about this, the health facilities, and COVID has demonstrated that you said that negative rate we have in terms of infrastructure availability. Now, in the context of any planning to strengthening the public infrastructure in terms of public health facilities, like India still have a 0.6 or 7% of the GDP total expenditure on the health. And also that bed availability, which we say is in India is much less, is 0.70 per 1,000 person, and which is much lower than even Maldives, Bhutan, and Nepal. So which you said that the kind of population which we have and the kind of challenges which we have faced, and my compliment to all your efforts and the government which is taking up since March till date, a lot of improvement which has come up in terms of treatment facilities and all this kind of preparedness and vaccine testing and all. So how do you say as a kind of a futuristic plan for India when we talk about pandemic like this, COVID-19?
You're absolutely right. Actually, we had the advantage of starting late in March, and therefore India, with the lockdown, was able to ramp up its healthcare facilities, whether it be hospital beds, whether it be oxygen, whether it be PPEs, whether it be testing. And that happened very, very rapidly as all of our government approach, directly monitored by the Cabinet Secretary's office and on a daily basis. So that was probably the reason why we were able to maintain and ramp up our facilities. Your point regarding our GDP is definitely a point of concern. We have a GDP of 1% for healthcare in our country, and the expand is about 4% across the country. But we do not want to look at the United States of America, where the GDP for healthcare is 19% of a $19 trillion economy, which is larger than India's economy, and still they are not able to provide healthcare for all. So we need to have frugal, low-cost innovations. Learn a lot from the NHS system in the United Kingdom, which has stood in order after the Second World War and has done well. Although it is becoming more and more Americanized now, with too much of unnecessary expenditure even in the NHS. I think we need to remain grounded, remain low cost, not create a paranoia, not over invest on healthcare, I would say more in, we have to invest on the basic infrastructure of healthcare, rather than trying to glamorize it overtly by use of too much of technology. I agree, some technology will be required, has to be used, particularly in telemedicine, etc. But we should be very careful in spending, and the government has emphasized that by 2025 it will definitely touch 2.5% of the GDP, which is huge. We have the capacity to absorb that, and we have seen that happen during this pandemic, that oxygen generation plants have been set up in medical colleges, laboratories have been set up in these 600 medical colleges across the country, the beds have been increased. So from that perspective, the government is very clearly focused on improving the health infrastructure rapidly and on a rapid phase. The data that is always touted, that we have 0.7 doctors per 1,000 population, and all those issues are definitely there. But the National Medical Council has been formed. The Medical Council has worked day and night tirelessly to improve the number of medical colleges, and rapidly they have increased to 560 across the country. The district general hospitals are also being utilized for training, and they are also being ramped up. Oxygen plants are being set up in district hospitals by the government so that oxygen generation can happen. So I think a lot is happening, and we feel that this pandemic has been responsible for the point that we always talk, that the healthcare is not funded well. A lot has changed in these 9 months, and I'm sure we are going to have much more focus on healthcare in the country, with India playing a major role for globally, not in the Southeast Asia region, but for Africa and also globally. As we speak, 1 out of 6 doctors in the world are of Indian origin. I think the same number is for the nurses across the world. 60% of the generic drugs are of Indian origin across the world. So from that perspective, India is very well positioned to, I would say, carpe diem, or seize this opportunity clearly in terms of being one of the global leaders for healthcare. Thank you so much.
Wonderful narration, and my compliment to you regarding the initiatives taken by Government of India, especially healthcare. One last question about this appropriate behavior from your side, and Dr. Sandhya would reflect later on that this issue. That people get panicked. You said that panic and paranoid behavior should be avoided. And people are taking many actions on their own whenever that WhatsApp universities suggest that vitamin D should be taken, vitamin C should be taken, and they start looking for different kind of tablets and medicine in the market. What do you suggest the larger audience, whether this behavior is appropriate or this is not?
I would clearly say that, and I've clearly told you that COVID appropriate behavior doesn't cost anything. The wearing a mask, washing your hands, and remaining at a distance and not overcrowding. And as Sandhya has clearly mentioned, that ventilation needs to be very well taken care of. Because what we have seen in the last 15 or 20 years, that many buildings in this country are being made air conditioned. Their ceiling are being lowered down by the engineers, clearly saying that it'll be more cost effective if the ceilings are lowered down, and therefore preventing the natural ventilation in a large number of our buildings. We need to be very clear about that. We need to maintain the ventilation in buildings, particularly most parts of India are warm. We do see 3 or 4 seasons in northern India. So we need to realize that 8 or 9 months of the country are warm. So, and we need to have good ventilation. You can also argue that when the air pollution remains a huge issue. And for that, I think the government is, with the parliament, is taking a whole of government approach in terms of the Ministry of Urban Development, as well as environment, as well as health, on looking at areas where we could catch hold of the low-hanging fruits, prevent stubble burning, reduce the number of cars, resort to cleaner fuels like electrical, and much subsidies for biofuels, etc., has also happened in the country. So we are seeing, as we saw a CNG revolution, the beginning, the end of last century, we will see more of solar and other cleaner fuels being utilized in the country. But here I would like to emphasize, in terms of our carbon footprint, India's carbon footprint, despite the large population, is still much lower than many developed countries, including the United States of America. And if you look at the Paris Accord as well as the Doha Accord, India is ready to sign that, and many developed nations are not, because their carbon footprint is huge. And we, as a nation, if we speak, we have excellent forests. We have excellent forests in India, and we should maintain the ecology. We should maintain the environment. If I were to say, we are somewhere in between Africa and America, or Africa and Europe, with the same amount of development as Europe and America, and the same amount of beautiful forests and wildlife in India as Africa. So, and we are definitely blessed from that perspective.
Thank you very much. I would request to kindly stay with us for 10 more minutes. Wonderful narratives you have given in terms of that India's position. One is that becoming a global leader on this, and also reflecting much on that this concerted efforts by all the ministries and the department together, not in as isolated category of that only health, but also looking holistically and don't copy the Western model of housing or low ventilated kind of infrastructure. A wonderful thing. And Dr. Sandhya, what is to be, Dr. Bhargav has mentioned many things, and then he said that about this hospital constraints, and also that the readiness of the hospital, and also about the vaccine and the challenges he also plugged in terms of that the monsoon, and also that the winter season and people in flux from the election areas to Delhi and all. So what would be now in this condition that hospital, when you get treated, when you are severity, and then what would be the appropriate behavior people should follow in the context which Professor Bhargav has highlighted to be taken care of. So what is your take on this, that people should not face hospital at all, rather than having he said that it's a no cost or low cost kind of a. So Dr. Sandhya, what is to the questions which I have raised to Professor Bhargav, you can reflect upon that also, Dr. Sandhya.
Thank you, Professor Kumar. Thank you, Dr. Bhargav. Actually, it was very good for me, living in New Zealand and with a large family in India and getting all sorts of, conflicting views. And I have, obviously doctors in the family as well. And, the highlight for me from all of that was the statement regarding the seroprevalence. Because, all I hear is Kiha, India, herd mentality, it's going on the herd mentality, which is absolutely incorrect. And it's that whole, the biggest challenge. And the reason you need this campaign is because, Indians, they said like, chalega, God will take care. And in fact, was it the other doctor who was mentioning, we've just had the, Ram Leela season, and whether the cultural things could, help people understand. One thought I had actually is that, Diwali is coming. And every, Hindu is so proud that, Lord Ram spent 14 years in exile and, abstained for 14 years. And here we're barely, if you think India went into lockdown in March, we're not even a year and people have given up. So where is that cultural, thing within Indians culturally, which is not in a lot of, Western cultures? We have that, we have inbuilt within us that, idealism of the importance of abstinence and behavior change for the greater good. However, due to, urbanization, Western influences, social media, consumption, and, disregard for our traditions, is that we have lost sight of the importance of abstinence. And I mean, if you want to, I think this is the ideal time to launch this campaign and say, really, in the big scheme of things, our generation is incredibly lucky because this is the first massive event we've had to face. Whereas if we look at our grandparents' generation, they had one event after the other. How did they cope? Nobody talked about suicide rates back then. And actually a lot of countries that, they in fact put this paranoia in people that, oh my God, if you lock down, if you do these things, you'll make people, depressed and suicide will go up. I mean, why put that thought into people's minds? I know in many countries, and even Victoria, just now I saw after one of the harshest lockdowns for, 116 days or so, I saw actually the statistics. There was no increase in suicide rate. Yes, the mental toll is there, and that's why I highlighted the whole mental resilience. And in fact, alongside doing that video, which, I mean, it took me by surprise. I recorded that video for my family. I mean, why should I, a GP in New Zealand, be talking on this platform? It's because of that video. It's because I realized that nobody is empowering individuals and giving them useful advice as to how to look after themselves in a scientific, simply explained, practical context. And the fact is, people all over the world, in fact, even I've had people respond that, I took my, 14-year-old son with COVID to my doctor and pediatrician in Texas, and they gave me your video to follow. So the point is, simple information resonates. People, the reason my video did well is I explained the why. And as I explained, Dr. Bloomfield, Dr. Ashley Bloomfield, who's a national hero in New Zealand, he said the profound statement that basically for any public health action to be effective and even clinical action, people need to understand why. And I think this is one thing that India should learn, because a lot of doctors have come back to me and said, from you I've learned how to communicate. I think a lot of people came out with videos after mine, because people, you cannot prescribe and in any behavior modification or any clinical treatment without explaining to people why. So otherwise that they will not comply. So exactly the same way, if you are going to say that you need to carry on masks, and the truth is masks will be the last thing to go, exactly 100%, as you said. And masks, that there's the Dr. Monica Gandhi in the US has done amazing studies which showed this feature of variolation, that the mask is actually like a vaccine itself, because not only does it protect you, it reduces the severity of an infection. So where Dr. Bhargava talked about that, WHO has said that a vaccine is permissible. The phase 3 tests the efficacy of the vaccine, but even a 50% effective vaccine will be approved. Now, wearing a mask is more effective than a 50% effective vaccine. So masks itself is a vaccine. So that little cartoon that I made, which I wanted the government to use, is I have explained from the beginning the science, and that the whole world in that tree, every individual's action affects that on that tree. If one person stops, you prevent that many infections and you break the chain. Same if you reduce the viral load by even one particle, exact same diagram. I mean, this was by a very gifted, he's actually my, I actually met him personally. Toby Morris came up with this genius, tree diagram, which is actually being used by WHO, because one of the strengths of the New Zealand response is the excellent scientific communication in very simple visual terms that helped people understand. So what Professor Dr. Bloomfield said is, when the Prime Minister got up and said the country is going to go into alert level 4 within 2 days, nobody asked why. They said, we get it, we understand, and they complied. And the message he said actually that the best definition of leadership is that leadership is a collective call to action. And that is what this Janandolan is. It's a collective call to action. And, there is power in that collective action, basically. So basically, that's why, and the message that went out in New Zealand was, stay home, stay safe, be kind. They put a lot of stress on be kind, and they said, look after each other. They didn't say look after yourself. They said, stay home, be kind, look after each other. And on every single media channel, 24/7, that message would be played. And that, and it was one message alone. So I think one of the biggest things that, if this campaign is to be successful, is people have to also highlight that there is going to be no herd immunity. There is no such thing. Everybody in India thinks, like even doctors I've spoken to in India think, India ko to herd immunity ho jayega. I'm like, it's not. To get herd immunity, you need over 80% of the population to have, antibodies, and we don't even know yet. We've had cases of, you mentioned 40 cases of reinfection, again, and so there's no guarantee, unfortunately. We don't know how things are going to play out. What we can only work on, and what is the point? What is the point of sitting and constantly telling ourselves there will be a vaccine? How does that help me today if I get infected? How does that help me? So that's the point. Protect yourself now, and when the vaccine comes, it will come. But until such time, these are the only 3 things you've got to remember. Wear a mask, watch your distance, wash your hands, do it properly. And now you're heading into winter, watch the ventilation. So yeah, I can't hear you.
Thank you very much, because you said that let the vaccine take its own time. But in the meanwhile, you just trust on the vaccine which is available in terms of masks, in terms of washing hands, in terms of maintaining social distancing, staying at home, and also caring each other. These are the vaccines to be propagated for the Janandolan, which Honorable Prime Minister has said. And what Professor Bhargav has mentioned in terms of that the clinical sense of and the strength of India as in terms of not only in India, but side by side also helping other global community in terms of providing treatment in vaccine and also that in research and collective kind of a concerns. So if we combine the two and we say that one is this, Professor Bhargav also reiterated your point, what you are saying, that probably this is no cost or low cost kind of a solution which we need to adopt, rather than just the battle of COVID and banking on the hospital care. That is a different story. We have gone very high, but still he's saying that go on a preventive mode, what you have suggested. So it's wonderful. I would just take a last punchline from both of you before I request Major General Bindal to say final words. Professor Bhargav, would you like to say something which is a takeaway that how this campaign of Janandolan on the Prime Minister has said about this and about the appropriate behavior where NIDM and NDMA and the Ministry of Home Affairs can carry forward with ICMR and other institutions, disaster management and the medical association together. Professor Bhargav.
Thank you. I think this Janandolan is gradually catching its speed and gradually being percolated across the country. We've had several icons speak for it. We've had the Prime Minister launch it, and he has spoken about it on his Mann Ki Baat. He took a sudden session at 6 p.m., sudden address to the nation. So from that perspective, I think this Andolan is going to be effective. The other point I want to emphasize here is that India is a very young democracy. We're only 70 years old democracy. So we still are far more open to being guided. We are not that democratized in every way that we will do what we feel like. Like many countries who are 200 years old democracies, 300 years old democracies, their liberalization, we are definitely much young, and from that perspective, it is easier to train, easier to direct, and easier to channelize. And this Janandolan will be probably the most effective thing for this pandemic, and an opportunity for India to demonstrate to the world how it can be done, as we did for the lockdown, in terms of it being a very moderate, balanced, calibrated lockdown. Similarly, this Janandolan, if it is very calibrated and I'm sure, and it is very timely, so this will be very effective if it is given more wings. All the best for that.
Despite of this, the Indian democracy and the kind of we have the kind of a social behavior. If I read between the lines, maybe I can say that still panel provision is needed to actually guide the people if they don't go for the appropriate behavior. What General Bindal also highlighted in his opening remark. Dr. Sandhya, what is your last punchline, which you would like to say what Professor Bhargav has mentioned here?
I would say simply that collective knowledge is power and that collective action is powerful.
Thank you very much. Collective knowledge is power and collective move is also
action.
A kind of action.
Collective action is powerful. So that's what the Janandolan should be. Give the people knowledge, empower them.
Thank you
as a
very much
whole.
for underlining these two words: collective power, collective wisdom, collective knowledge, which is going to
Collective
actually
knowledge,
make it
connective. There is no power in the collective without the knowledge.
without the knowledge.
So
So that
the
should be
job of
the
the job of the authorities is to provide the knowledge in an easy to consume, simple, and accessible manner for the common man.
Thank you very much for giving this insight. And before I formally thank you, I request General Bindal to give his remarks on the entire deliberations which happened, then take away. General Bindal, please, Executive Director of NIDM.
Thank you, Professor Santosh. So much has been said that it is not possible to sum. Such great amount of insight has been brought in by Dr. Sandhya about what to do and how to do, and the steps, positive steps taken by the Indian government as given by Dr. Balram. They are a big motivator by itself. And this YouTube video, once we upload it on our social media website, and a lot of people will be watching it, thousands of people will be watching it. This itself is propagating appropriate COVID-19 behavior, wherein we are telling them as to what requires to be done, and we are also assuring them that the government is doing the best possible and is the main driver, that lot of so-called developed countries are also looking forward to what India is doing, how India is combating, and how India is successful. Because even today, we have not even touched 1% of our population, whereas most of the developed economies have touched 3 to 4% of the total population getting affected. So there is a lot to learn from what India has done, which has been rightly brought out by Dr. Balram Bhargav, and how and why we should take appropriate behavior, and how we can motivate the local youth and others, and how we can explain the issue to them has been brought out very well by Dr. Sandhya. So I'm thankful to both the speakers for giving out such detailed insights and for coming on the show and from the busy schedule. And also I would like to thank Dr. Kamal Kishore, who was here, member NDMA, who is spearheading this cause from the National Authority, and has always been a source of inspiration for all of us. So with this, I thank everyone and all the participants for good learning that we had for last 2 hours. Thank you so much.
Thank you. And Dr. Sandhya, we take your permission. If you can share that video, we can, since you have developed in different languages, Indian languages, that would be very, very beneficial. And if you permit us, we can put it on the NIDM's website to the state government with the permission of yours.
Absolutely, 100%. That's what I've done it for the common man. I can do the hard work, but I can't get it to the people that need to hear it. And I know that it will help, calm people. It will help people be prepared, and it will help reduce the strain on, my colleagues in India. And that was my intention.
Yeah, I see that millions of followers on YouTube, your video. So that would be very, very beneficial. And thank you very much for giving your consent for using this video for the larger public dissemination.
Oh, absolutely. That is my heart's desire, actually.
Thank you very much. So it's I would like to convey my heartfelt thanks to Dr. Balram Bhargav, to Dr. Sandhya Ramanathan, and also Major General Manoj Kumar Bindal, Executive Director NIDM, Mr. Kamal Kishore, Member NDMA, Dr. Anuradha Amoria, who is the coordinator of this webinar. My heartfelt thanks to everyone who could maneuver, and this is going to be a big campaign for India as a Janandolan, which Honorable Prime Minister said. And the point suggested by all the speakers, Dr. Bhargav and you, and Mr. Kamal Kishore, General Bindal, we will be designing our campaign in future also, and we will be using as well. And we will also definitely will get some support from ICMR, because they validate the content of many of the things which are going into a kind of a public domain, whether it's medically true or false and whatever. So we would be grateful for your support, Dr. Bhargav, in future also in designing our campaign. And Dr. Sandhya, thank you very much. Thank you very much. Thank you to everyone, all the distinguished participants who have joined this campaign, and we wish you to kindly spread these messages. Should not remain confined to you only. So you share with your better half, your family, and friends and take this forward. Thank you very much to all of you. And we say thank you very much once again. And we take the permission to close this this webinar. It's a very, very useful webinar, which I have heard on COVID-19, on the public behavior, appropriate behavior, and also the clinical capacity of the Indian government, which is taking into as a kind of a global health. Thank you very much to all of you. Dr. Anuradha, thank you very much for taking this, and kindly close the.
Sure.
Thank you. Bye-bye. Bye-bye.